students, how are you? This is the video I'm going to do about the tongue. I would divide this topic in two videos. First video is about the general features and muscles of the tongue, both intrinsic and extrinsic. So let let me start with the tongue general features. So here you can see the tongue is actually a very muscular organ which is present in the oral cavity and pharynx. So it has been divided in different parts. First is root of the tongue. Here you can see in this diagram. Then it has got body, and the tip of the body is called apex of the tongue. So body is mostly present within the oral cavity, whereas the root is present in the pharynx. So in this diagram here you can also have a very good look here. So this is the tongue. It is the dorsum of the tongue. You are looking at someone's tongue protruding out of mouth. It is the view which people usually look at. So tongue has been divided into two parts, anterior 2/3 and posterior 1/3 by means of a sulcus which is called sulcus terminalis, shown here in with the blue line. This is sulcus terminalis. Here you can, this is a V-shaped circle. Anterior to this circle we have got anterior 2/3 of the tongue, mostly body and apex, whereas posterior to this blue line, which is sulcus terminalis, we have got posterior 1/3 of the tongue. And just anterior to the sulcus terminalis we have got a very special feature. These are special type of papillas which are called circumvallate papilla. I will discuss about it later on. So this angle of this V is directed posteriorly, and here you can see the pink circle. It is showing the presence of a pit called foramen of cecum. This foramen of cecum is embryological remnant of thyroglossal duct from where thyroid gland develops, and so it is non-functional part of the tongue. So we were discussing that anterior to this tongue, here we have got anterior 2/3 of the tongue, and posterior to this sulcus terminalis we have got posterior 1/3 of the tongue. So anterior 2/3 is mainly body and apex, and tip of the body is apex, whereas here you can see root has been shown with the yellow part heading. So this posterior 1/3 of the tongue is in the pharynx, whereas anterior 2/3 of the tongue lies in the oral cavity. So there are number of papillas which are special features of the tongue, histological features. They are present in the tongue. They are scattered throughout the tongue. There are circumvallate papillas, foliate papillas. Then we have got filiform papillas. So about these papillas you would be studying in more detail in histology and or histological class. So here you can see, here we have got special type of papilla which are present in the form of small circles. They're arranged in a V-shaped alphabet, English alphabet V shape. These are called circumvallate papillas or vallate papillas. They are called circumvallate papilla because they are rounded in shape. So in next diagram I am going to show you bigger picture of same papilla, circumvallate papilla. These are circumvallate papillas. Here they are present in the V shape, and then here just posterior to the sulcus terminalis, here we have got foramen of cecum. Now this is an enlarged diagram of circumvallate papilla, which has flat top, and there is a moat like trench like area present around this circumvallate papilla. They are circular That's why they are called circumvallate papillae. And in within this trench here we have got taste buds which are studded here in this trench. So the rest here filiform papilla, you can see conical structures, then fungiform papilla. So in your histology class you are going to do bit detail of these papillas. So now again on the post here you can see this tongue has got mucous membrane over it, and this and different papillas scattered throughout on the dorsum of the tongue, whereas on the posterior one third of the tongue there are no papilla. Rather, there are special type of lymphoid nodules which are present in the form of nodules, and they give tongue appearance just like cobblestone appearance. Cobblestone appearance. So these are called lingual tonsils. Lingual tonsils because there are lymphoid tissues and present within the tongue in the posterior one third. So that's why they are called lingual tonsils. And here you can see these are palatine tonsils. On either side, we have got two palatine tonsils. They are present in a special area. Here we have got two arches. Between these two arches, we have got palatine tonsils. So again, this diagram is showing that different types of taste they are felt on the different parts of the tongue. For example, sweet at the tip, bitter at the posterior part of the tongue. Likewise, why? Because these papilla they are special, type of structures which bear the taste buds, and they're scattered in different parts of the tongue. So that's why different tastes are felt in different parts of the areas of the tongue. Now, before that, this, as I told you, this is dorsum of the tongue or dorsal surface of the tongue, whereas ventral surface of the tongue is inferior surface of the tongue. So, what are the muscles? Tongue is actually a muscular organ, and tongue is very, mobile structure, and it assumes different shapes and different positions. Means there are two types of movements which are present in the tongue. One, it de-shapes itself, it changes its shapes, and second, it changes its position. When sometimes you protrude it, sometimes you stick your tongue out of your mouth, sometimes you take it back, sometimes you touch with your tongue to your inner side of your cheeks, inside from gingival surface of the cheek. So you there are two things are happening with the tongue. One, it is changing its shape frequently, and second, it is moving a lot. So there are two types of movements within the tongue. One is for changing its shape of the tongue itself, and second is, changing the movements position of the tongue. So with this aspect, tongue has been divided. Muscles of the tongue, they have been divided into two parts. One are the extrinsic muscles of the tongue, and second group is the intrinsic muscles of the tongue. As the name is, giving you a clue that one group of muscles is present outside the tongue. For example, these are extrinsic muscles of the tongue. Here is the tongue, and muscles are present here. All the muscles are present outside the tongue. So these are extrinsic muscles of the tongue. But second group of the muscles is present within the tongue itself. Within the tongue itself, you will be seeing it in a while. So extrinsic muscle and intrinsic muscles, so they have, both of them have got different function. As I just discussed, the extrinsic muscles are concerned with the movement or changing position of the tongue, whereas intrinsic muscles, they deal with the changing the shape of the tongue. So I hope you better understood the difference between two. So, what are the extrinsic muscles? We will start from the extrinsic muscles, and we will see what are the extrinsic muscles and how they play their role. So there are four extrinsic muscles in the tongue and four intrinsic muscles in the tongue. So here you can see there are four muscles: geniohyoid, genioglossus, hyoglossus, styloglossus. So again, these names appears to be very confusing, or like difficult to remember, but actually they are not. They are very easy, or they have been named very sensibly, and if you try to learn them with with sense, they are going to you're never going to lose them. So, first of all, we would go with the genioglosses. So this name has got two parts. Uh, One is word genio and genio, and other one is glosses. Always remember the word glosses is for the tongue. Wherever the word glosses would be, it would be related to tongue. So it means that all of these muscles, these three muscles, especially genio, glossus, genio, these three muscles, these are actually tongue muscles, and geniohyoid is a suprahyoid muscle. Forget about it. So here we have got three muscles have been shown, which are extrinsic. Actually, there are four in number. Out of those four, three have been shown here. So genioglossus, as I told you, it has got two words, genio and glossus. So whenever there is a word glossus, it means tongue. So what I'm going to show you, what is genio and where does it come from. So here you are looking at a mandible bone from inner view of the mandible. Here this is symphysis manti, where two halves of the mandible they unite together. Here you can see four small tubercles. These are called mental spines, and or these are called genial tubercles. Two are superior and two are inferior. While studying the extrinsic muscles of the tongue, always remember these genial tubercles. They are four in number, two superior and two inferior, and they are present on the mandible, near the inferior border of the mandible, on its inner surface. Inner surface. Always remember them. So genioglossus. Genioglossus mean that this muscle is originating from genial tubercle to superior one, which I just showed you. Superior genial tubercles or mental spine, they arise from there, and they, you know, expand like a fan, Chinese fan. They expand like a Chinese fan. And this genioglossus muscle, it inserts into the tongue. Here it inserts into the tongue, into the dorsum of the tongue, anterior to posterior dorsal of the tongue. So this blue one structure you are looking at, they are two in number, one genioglossus on one side and other genioglossus on other side. So actually they are two in number genioglossus. So I'm going to show you genioglossus here again. So from the genial, this is the sagittal section you are looking at, sagittal section of the tongue. And this is tongue, this is hard palate you are looking at, and this is soft palate. And this fan-shaped muscle is genioglossus. Genioglossus, this expanded muscle, this is all genioglossus. And this genioglossus disappears under this muscle, which we are going to do later on. So this muscle has got three types. Genioglossus has got three types of fibers: anterior fibers, middle fibers, and then inferior fibers or posterior fibers. So these inferior fibers, they insert into the hyoid bone. They insert into the hyoid bone, whereas most of the middle and anterior fiber, they insert into the dorsum of the tongue. Here they moves inside the tongue and they insert, and especially the anterior genioglossus, it is inserted up to the tip of the tongue. So actually, what is their action? all these three types of fibers, they have different type of function. For example, genial glosses, most inferior muscle fiber, when they will contract, the muscle fiber length will decrease, and this part will pull the hyoid bone anteriorly. As a result, floor of the mouth would be shortened, or it would help the tongue to protrude. It would help that when this larynx, hyoid bone would be moved forward. As a result, tongue would be protruded out of the mouth. So what this middle fibers are going to do, these middle fibers, as they would be inserted into the dorsum of the tongue, when they will contract, they will pull this dorsum of the tongue towards themselves. As a result, if both genial glosses on bilaterally do on both sides do same action, as a result, tongue would be depressed. Whereas these anterior muscle fibers, when they will contract, they will pull back the protruded tongue and retract the protruded tongue back into the mouth. So here we have got again genial tubercle superior in posterior fibers to hyoid bone, middle fibers to dorsum of the tongue, and anterior fibers to dorsum of the tongue till the tip of the tongue. So posterior fibers are going to pull the hyoid bone anteriorly. As a result, it would help the tongue to protrude out of the mouth. Bilateral action of the middle fibers would depress the tongue, whereas anterior fibers are going to pull the tongue, protruded tongue back into the oral cavity. So what I'm going to do, I'm going to show you same thing here. Look at this. This is genial glossus muscle from the genial tubercle, and in posterior fibers they are going to attach onto the hyoid bone. They will pull the hyoid bone anteriorly. Middle fibers are going to the dorsum of the tongue, whereas anterior fibers are going to the tip of the tongue. As a result, when these anterior fibers alone, they will contract, they will pull back the protruded tongue into the mouth, whereas posterior fibers will pull the hyoid bone anteriorly. As a result, tongue would be protruded, and the middle fiber, they would depress the tongue. So here again you can see in oblique view. So here we have got a pair of genial glosses, one on either side. Now the second muscle is hyoglosses. Hyoglosses. Again, this muscle has got two parts in its name. One is hyo, other is glossus. So hyo, here you can see the hyoid bone. Hyoid bone. Now this is the hyoid bone body and greater cornu. This is the lateral aspect you're looking at. So hyoid bone is attached onto the body and greater cornu or horn of the hyoid bone, and it is a quadrilateral muscle. Quadrilateral means it has got four sides: 1, 2, 3, and 4. And fourth side, it is inserted into the side of the tongue, into the sides of the tongue, and it merges with the intrinsic muscles of the tongue. So whenever we have got one hyoglossus on right side and other hyoglossus on the opposite side, whenever these muscles contract, they are going to depress the tongue, or they are going to depress the tongue and pull its lateral edges downwards. So this was hyoglossus. Here in this diagram you can also look, this is green one is hyoglossus. Hyo means from hyoid and glossus means the tongue. Now third one is styloglossus. Styloglossus. So here again it has got two parts in its name: stylo for the styloid process and glossus for the tongue. So here we can see this is styloglossus muscle. It is attached onto the anterior surface of the styloid process, and here you can see stylohyoid ligament. This cord-like structure, stylohyoid ligament. It is originating from the styloid process and going to attach on the hyoid bone. So that's why this is ligament. And this muscle, which is styloglossus, it originates from the anterior surface of the styloid process, plus few fibers. If you look carefully, from this ligament as well here. And both styloglosses on either side, its fiber, they are going to merge with the hyoglossus muscle. Hyoglossus plus it is going to give inferior longitudinal band of the intrinsic muscle, inferior longitudinal, which I'm going to discuss later on. So this is styloglossus muscle, and this styloglossus muscle, as you can see here, it is, you know, this it will pull the tongue back into the oral cavity. When on either side these muscle will contract, and they are going to pull the tongue back into the oral cavity. Now the fourth muscle, it is palatoglossus muscle, which I told you not been shown in this diagram. Actually, the fourth muscle is the palatoglossus. So again, this word has got two parts, palato and glossus. Palato means palate. So here you can see, hard palate, then you have got soft palate. So it is a crescent shaped muscle in the soft palate. It arises from the soft palate and is inserted onto the sides of the tongue, So one palatoglossus here and other palatoglossus on other side. What these palatoglossus, when they will contract, they are going to elevate the tongue, or vice versa. If tongue is stable, they are going to pull the soft palate downwards. So it has got two functions. So this is the reason, this is the muscle of the palate. Palatoglossus is a muscle of palate plus muscle of the tongue as well. So it is originating from the palate, so that's why it is supplied by the like rest of the palatine muscles, it is supplied by pharyngeal plexus, whereas most of the all of the rest of the three tongue muscles, which are extrinsic tongue muscles and intrinsic tongue muscles, they are supplied by the nerve, hypoglossal nerve, which is the 12th cranial nerve, which I would be covering, the nerve supply of the tongue in next video. So now I'm going for the intrinsic. So which another thing which I need to tell you, this is bulge or pillar produced by the, it is mucous membrane covering the palatoglossus muscle from palate to tongue, palatoglossus muscle, and it is covered with the mucosa. And here we have got palatopharyngeus, this is pharynx, palatopharyngeus, and in between we have got palatine tonsil. These are pillars or fauces of the pharynx, which I am going to show you here. This is, in this diagram, the mucous membrane have been removed, and this is palatoglossus arising. This is soft palate. From palate, it is, this muscle is arising and inserting into the tongue. This is palatoglossus muscle. So this is the pharyngeal part of the tongue present in the pharynx, and rest anterior 2/3 is the oral part of the tongue. This is hypoglossal nerve supplying all of the, except for the palatoglossus. It is not being supplied. The rest of the muscles are being supplied. So now intrinsic muscles. Intrinsic muscle, like as I told you, extrinsic muscles are responsible for the changing the position of the tongue, whereas intrinsic muscles of the tongue, they are concerned with the changing the shape of the tongue. So here you can see this is central groove. From this central groove here, this is the coronal section of the tongue has been shown. This is median fibrous septum, which divides the tongue into two equal halves, right and left. Internally divides the tongue into two equal halves. So here you can see superior longitudinal, these are intrinsic muscles, which we recently just which we discussed, those were actually the extrinsic muscle, but here we have got intrinsic muscles. So here you can see, here we have got superior longitudinal band which is present longitudinally along the length of the tongue here, and likewise here we have got inferior longitudinal muscle. This group of muscle is also, muscle fibers are also arranged in longitudinally along the length of the tongue, and in between here we have got vertical which are muscle fibers, and then horizontal muscle fibers where they are present. So superior longitudinal muscle fibers and inferior longitudinal muscle fiber, what both of they do, they actually when contract, the muscle fibers are present along the longitudinal as arranged in a longitudinal manner. So as a result, tongue is going to be retruded and becomes thick. Tongue is going to be retruded, taken back into the oral cavity, and it would become thick. Whereas these muscle fibers which are vertical and transverse, when they are going to contract vertically and horizontally, what they are going to do, they are going to make the tongue protrude out of the mouth, and they are going to make the tongue narrow. So these are intrinsic muscles. So again, in this diagram, this is again coronal section of the tongue. Here it has been shown, these are superior longitudinal muscle group, these are inferior longitudinal, and in between we have got vertical and horizontal muscle group. So superior and inferior longitudinal muscle group, what they are going to do, they are going to protrude the tongue, retrude the tongue, and they are going to make the tongue shorter when they contract along the length of the tongue, these muscle fibers, and whereas transverse and horizontal fibers, they are going to make tongue narrow and increase its length. As a result, tongue would be protruding out of the oral, mouth or oral cavity. Okay, so again, the most important thing which this video is all about, it is about basically extrinsic muscles of the tongue. Again, from genial tubercle, glosses. Then hyo from the hide bone, glosses to the tongue. This muscle, quadrilateral tongue muscle. Then stylo from the styloid process to the tongue, glosses. It merges with the hyoglossus muscle as well as inferior longitudinal, which is intrinsic muscles of the tongue. Then palato, glosses from palate to the tongue. I hope you understood the muscles, both extrinsic and intrinsic. For I would be doing another video for nerve supply, lymphatic drainage, blood supply of the tongue. I would try to cover everything in that part of the video. Thank you very much.